Enoch, what do you do in your role?
So in my role currently, well, it's been a little bit of a transition recently because within the last couple of months things have changed. So currently I'm seconded podiatry team lead, and in this role it encapsulates a lot of different things that I do. So managing the team, seeing how everyone is, keeping on top of the day-to-day things that are going on in podiatry, things like making sure clinics are up to scratch, and then also patients are receiving the right sort of treatments that they should be receiving. And then also looking at the staff or the members aspect as well, making sure everyone's okay, and if they're not well, changing things about to get someone to go and cover their clinic, and then just trying to make sure that we're meeting the standards that as a team we should be meeting. So it's not just a one thing or just I'm in a clinic, but sometimes, yeah, it's a lot of different things that happens within the podiatry team, yeah. So it's quite a few things, yeah. How about yourself?
Well, I suppose in my current role I'm managing a few different teams, and I've been seconded into that role, and you've been seconded into my role, haven't you, Enoch?
Yeah.
So what I did do as a podiatrist when I first qualified, working for the Trust, just worked across Shropshire and Telford in various different clinics. So podiatry covers things like nail surgery, so we manage people who've got very painful, infected, ingrown toenails, don't we? Using local anaesthetic and preventing that nail growing back. We do a lot of diabetic foot care, don't we?
We do.
So we do some of the checking of people's feet, reviewing their feet, but also managing the problems that they develop, sort of, from hard skin and corns to diabetic foot ulceration, and working with the consultants in a multidisciplinary team within the hospital trust in Shropshire. But we also see those patients out in our community clinics. We also have musculoskeletal podiatry, and we have our children's gait clinics, and over the years I've been involved in all of those, which I've really enjoyed. Go on.
Yeah,
so,
that's quite a lot actually. Yeah, what we provide as a team with the podiatry department, it's quite a lot. And I think it's significantly different from what some of the unfortunately what some other healthcare providers might see and think, oh, podiatry, all they do is nail cutting. But when you go into the scope of things, there are lots of different departments or different things that we provide as a team, and even routine nail care is something that's not provided within the podiatry team. So that is quite a big scope we cover.
And I think unlike other professions, we do all cover all of those things. So you can see anything walk into your clinic, from vascular problems to musculoskeletal to patients who've had an injury and fractured a foot. So you can come across anything really, can't you?
Yeah, that's
Which is
true.
really interesting. And I think what I really enjoy about it is that for us, most patients go out feeling a lot better than when they came in. So there's sort of almost an immediate relief with it, isn't it?
Yeah.
And that autonomous practitioner type of thing, where you're not waiting for somebody else to give you a diagnosis. We do our own diagnosis and
give you the treatment,
give the patient the treatment plan and the advice. I think we have moved on nowadays. When I first started working 23 years ago, we used to see a lot of people very regularly, and now we're very careful about giving patients that advice and encouragement to self-care.
Education is very important.
That's becoming even more important. And I think over COVID we realised that we could utilise some sort of telephone triage, couldn't we, in some areas, which has helped us recovering from that.
Yeah, and I think we're still using that even now to do some to help out in some areas where, like you say, there's some patients who would initially say or have a referral come through, and immediately previously would try and see them, but now we can do a telephone triage and see what the problem is, whether they actually just need some education over the telephone, and they can continue to sort of improve their foot health conditions, and so that's something we still utilise. So that's something we've taken from COVID.
And you've been doing something different over the last year, haven't you, Enoch? So
yes.
You were doing the
I have, yeah. So I think it's been just under a year now. I was doing I was leading the diabetic foot screening. I took on that role of diabetic foot screening lead, and in that we've been trying to educate and go into GP practices. So educating the members of staff this time rather than the patients, focusing on the members of staff, so the HCAs, the nurses, and nurse associates, anyone who's available within the GP practices, to really help them to when they're doing things like foot screening, which I think it's quite essential. It's, if not a cornerstone of the diabetes treatment, so treatment of diabetic patients really. So I think it's essential that they are up to they're more confident in knowing and finding these sort of red flags and things that might lead to complications or serious complications within the diabetic patient. So it's been quite fun and quite interesting, and going in to see and thinking that some of these nurses would have known some of these things, but it hasn't obviously been brought to sort of the front of the knowledge that this is something that needed to be done or to be look out for. So it's been very interesting, and it's quite an eye-opener and helpful for them as well. So it's been good, good thing to do.
You've done some of that training over Teams, haven't you?
We've done quite a few of that training over Teams, yes. And I think the one place we got our sort of a bit of training from ourselves was from the Scottish framework, which was seen as the gold standard. And from there, we've done some Teams as well as some face-to-face training. And I think both has helped considerably, in gaining their confidence or improving their confidence.
And how did you get into podiatry?
Oh goodness.
What did you?
So I went straight from secondary school to sixth form, and then straight from sixth form into university to study podiatry. Initially, I was looking at different courses or just healthcare in general. But I remember when I was in sixth form, we were in a biology class of about, I think there was 24 of us in that biology class, and I think 4 or 5 of them wanted to go into physio. And I thought that seemed like something nice to go into, but then I thought about it, thinking if 4 out of the 24 people are not one class, what about the whole school, and then what about the rest of the country? It might become an overpopulated sort of profession, and we might struggle to get a job once you qualify. So I looked at alternatives, and my careers advisor at secondary school brought podiatry up. So I went to Cardiff Metropolitan University to go have a look on open day, and I saw it and I thought, oh, I don't mind feet actually, I could actually deal with them. Because you've got the few people who see feet and they're like, oh gosh, no. But I saw to it and I was like, oh, this is actually quite good, I could do this. And I enjoyed it ever since. And 3 years down the line after going to the university, I applied for a role in Shropshire, which brought me back home because I lived in Telford area. So I got the job and I started this career, and I haven't looked back since. So it's been good so far. So I can't complain.
That's nice.
Yeah. How about yourself? Because you said since you started this role quite some years ago, how did you get into podiatry?
I was working for my dad, who's a pharmacist, and I was talking to one of his locums because I didn't know what to do when I'd kind of done my A-levels. And he said, oh, why don't you do podiatry? And I went along to Salford. Oh. And I qualified in 1990, so it's like I'm like an ancient dinosaur. So I've done lots of different things, I suppose, over the years. So I started off just a general podiatrist. Then I think I ended up being the person who did most of the nail surgery in the team. So I kind of specialised in that for quite some time, and then moved into musculoskeletal podiatry.
Oh, okay. And
went to work for the Telford Musculoskeletal Service, that was very interesting because I was working alongside the physiotherapists. Oh. And you have a team of advanced practice physios there as well, and the orthopaedic surgeon. So that was that was a really good opportunity for me to see how things could work in a different service.
Okay.
So I think that was my first time
okay.
stepping outside of the podiatry team.
Yeah.
And then when I came back and took on the service lead role, and then last year I went away and did the governance manager role for the vaccination service. So I've kind of, since working in the NHS, I'm just really interested in how it works.
Yeah.
I find it quite fascinating what everybody does and what the different layers of the services are. So when I was in the governance role, I attended some of the regional governance meetings and around COVID, and there were also various other things, and that was very interesting to see how that works. Okay. So I think stepping then back into podiatry, and it's been interesting to bring that with me.
That's good. That's good.
And then,
so I guess that's all sort of molded in you into sort of where you are, or the role that you're in now, with the different sort of experiences, and being sort of interested in seeing how everything sort of works. Yeah.
Well, you also realise that the problems that you're having in podiatry team are the same, similar problems to other teams. So podiatry is a profession under threat, isn't it? We don't have enough people coming through university to manage an ageing population, so we see a lot of older patients, particularly with type 2 diabetes, and we really need some youngsters coming in, or not even youngsters, anybody. We have quite a few people in the team who've done podiatry as a second
degree,
second
profession,
profession, who come into the team in their 50s, and have a really good final few years of working. Because podiatry is a really nice profession to do. You can talk to your patients, you want to get to know them, you need to be able to engage with them, and it's really nice. So
I was going to say, I think that's one of my sort of the reasons why I enjoy podiatry so much is, one, the interactions you're having with the different patients that are coming in, and I think something you mentioned as well was when the patient comes in, they might come in with a problem, you're able to sort of diagnose, treat that before they leave, so they're able to get that relief within that same session. And even if that can't happen in that same session, it's up there, you can put a plan in place which can achieve that. And I think the one thing I really enjoy about podiatry, but in both roles that I've undertaken, or all three roles I've undertaken in podiatry, is the fact that there's something different every day. So in a clinical aspect, today what I'll see in clinic compared to what I'll see tomorrow, it's absolutely different, and you can't bet on there to expect what you see.
No.
And that's the same with the podiatry team lead as well. What's going on today could be completely different from the set of emails you get tomorrow, and sort of things you need to sort out. So that keeps me on my toes, and I think I really enjoy that aspect of the job of podiatry. So that's probably some of the best things that I like about podiatry. I'd say.
So, and I think it's nice. I think now the AHP roles within Shropcom are being highlighted, and I think that the positive input that we can have in helping patients to not be hospitalised. So we know with the diabetic foot that we need to get that foot under control. Hospitalisation and amputation of the lower limb with diabetes is a big problem really for the trust. So trying to do our best for that, aren't we? Yeah.
I mean, I guess moving forward, or thinking about what to achieve next in career, I'm very, very glad to have had this opportunity to do the secondment role, because I remember when the role came up for the foot screening lead, I thought, oh, do I want this? Do I not? I don't know what I think about going into a bit of management, a bit of training, but I've always enjoyed that aspect where there is a bit of training or learning. So I definitely put myself forward for the foot screening just so I could get the experience from that. And then when I realized the team lead opportunity came up, I thought, oh goodness, no, what's going on here? And then I put myself forward and I thought, let me just take what I've learned from doing the foot screening lead into that role. And initially, when I started podiatry, honestly, I thought I was never going to go into management or even touch anything of it. But the more I sort of step into it, the more I appreciate what's going on within the team, within the trust itself, because there's a whole lot more to sort of do. So going forward, I think if this role becomes, there's another sort of secondment developing, or another sort of role, secondment comes up, I think I would possibly be interested in going in again and taking what I've learned this time round to add to that, and it will ideally make things a lot easier to the second time round to do things.
Yeah.
But obviously you're still learning. Going back into sort of podiatry as in the clinics full time, I think I will still enjoy that. But I think looking forward, I think in a way I want to follow your footsteps, in the sense that you've dabbled in a few different things in a few different teams, and it helps you understand the trust and also understand how things work within the NHS itself a lot better. So I think that's something that I want to still keep my fingers in, sort of, moving forward. So that's something that I think interests me, and I want to achieve in career. Yeah.
I think it's that kind of, and I think you're similar, kind of wanting to keep challenging yourself and wanting to keep learning.
Yeah.
So I find the NHS really interesting, just in how intricate it is really, and yet how everyone works to make it seem like a seamless process for the patient. So I think that development's definitely there for you, isn't it, Enoch? Wow. Stepping into the role I'm doing now kind of felt like the right next step for me. I wanted to continue working for Shropshire Community Health because I really like their values and beliefs now. They are moving and making the right choices and supporting their staff now, and that, you know, you can really feel that happening now. I really just want to continue doing what I'm doing really now. I suppose we've only been in our roles a couple of months, haven't we? So
it's still early days.
So it's still early days. It takes quite some time to really get to grips with it. But I've had I think we both had support, haven't we, from everyone around us, and that again is one of the nice things for working for Shropshire Community Health, is that you have got a whole team around you who are happy to help, and you can ask questions and ask the stupid questions and not
all the time.
be afraid of getting laughed at, really. Yeah.
That's the best way to learn, to ask those questions, because I remember stepping into this role, I think that was my main concern. On my days, I'm going to have to ask all these questions. Can I do this? Do I have the right support? And I remember when I had that chat with you in your office before I put the application in for the role, because I thought that was my main concern. Would I have enough sort of support? And even the staff in the office, the admin team, they were the ones who initially put the idea into my head, go for it, you can do this. And I thought, whoa, I mean, it's a big ask. So, and they were like, yeah, we're here to support you. You've got other members, you've got people who've previously taken on the secondment role, and Becky were there as well to help. So if you do need help, there is help there. And then I had that chat with you that confirmed what I thought. So I was like, do you know what, this is the next step. So why waste such an opportunity that's knocking? Definitely, you're right in that aspect. I think that support aspect, or that support system, is there to help us. I suppose nobody wants you to fail, do they? No, so, exactly. All part of one team. So.
Yeah, we all want to succeed, don't we?
Yeah. Definitely.
And what would be your advice to somebody else seeking a career in podiatry, Enoch?
Wow. I'd say definitely make sure you don't have any phobias of feet, first of all. Because if you do, you're coming into the wrong profession. But just being confident, being driven, and always wanting to learn. I think those, for me, were the three key things that I think I brought with me when I was coming into this sort of profession. Because with a profession like this, there's always something to learn, there's always something new. you've always got to continue your CPD. So there's always going to be newer research, new information out there, and being ready and willing to learn. Also being a team player, because although most of the time it seems like we do a lot of lone work, you're still part of this intricate team where you've got the admin team, you've got the all the different different leads. So the diabetic lead, the MSK lead. If there is any sort of questions, any queries that you have, just being able to sort of open up and going up to them and then asking and speaking to them. All of these are things that can help you develop yourself as well as giving the best sort of treatment, golden treatment for patients.
Yeah, because we do tend to work on our own a lot, don't we? We have, it's unusual to have clinic locations where we have more than one podiatrist working there.
Yeah.
So I think nowadays with modern technology and teams, we can get in touch with each other a lot more quickly, can't we? But as podiatrists, you do tend to have that real sense that you are an autonomous person making your decisions within the framework and policies of the trust. Yeah,
that's true.
Yeah. So I suppose when I first started in podiatry, I had a young family, and you know, it was a good career for me. Yeah. I didn't really start to do any stepping up and leadership for a few years. I just really settled into the role, and yeah, it can be quite a strange stepping into the role when you go from being in university in a multi-chair clinic, can't it, to just being on your own.
Oh my days.
But yeah, if you're starting now in podiatry, we usually give you a good few weeks of sitting with people and shadowing, and normally the new podiatrists will say, when am I going to get to do my own clinic? And I say, well, just give it a little bit of time.
You'll have more than enough.
Yeah. So we do like to support people, even if they don't want it, in their new role. And we've got apprentice podiatrists, haven't we? So there are different routes now opening up into podiatry, aren't they? We have HCAs in the team now, and hopefully that will be a route into becoming an apprentice podiatrist and a podiatrist. So it's things are improving, aren't they now? I think. Those
sort of aspects now, with like you said, the apprentice and the HCAs, I think it's also helping with the services moving forward and bringing on some ideas, like you've said, with the potential of the HCAs moving on to apprentices, podiatry apprentices, and then possibly even podiatrists. So that will help with the profession as it moves forward.
And I think because Shropshire is a lovely place to work, and I moved here from Manchester. And I got married 32 years ago. But it is a lovely place to live. It's a really lovely place to bring your children up. And it's been a good place to work. You know, people move here, don't they, from say Birmingham or one of the big cities, and the largest or the furthest they'd have to travel to cover their trust is probably about 5 miles or so, isn't it? And here, if we travel from one of our clinics in the north to one of our clinics in the south, it'd take us over an hour, wouldn't it? But it is lovely. Driving into work this morning, and you know, it's just so beautiful. It's a lovely drive into work.
Yeah, the views are astonishing.
Yeah, it's a nice place to work. Yeah, and I think the community team aspect of it now, I know stepping into the role I'm doing now, I can see how the community teams are working more together now. So we work quite closely with the wound healing service, don't we? Do a joint clinic with them for the diabetes foot ulceration over in Telford. We work quite closely with the community nurses, supporting them with some of their foot ulcer patients. So we're all trying to help each other, aren't we? Yeah.
That's true. Yeah, because that reminds me, because when I'm out on DOMs at times, there are times where you have to liaise with one of the district nurses, and you go in together to see a patient. So we are working quite well together with all the different services as well. So looking at the podiatric input around it.
So that offloading of wounds and or the pressure on the foot when you're healing a wound makes it completely different to healing a wound on an area of a body that isn't taking
any pressure.
Yeah, the pressure of walking. So and also the pressure of footwear and falls for older people when they have things like this. So there's quite a few things that we can have input in.
That's true.
That isn't necessarily apparent. To anybody outside the service. Yeah.
With regard to
we have, the moment we've got two students from Salford, haven't we? But we can take students really from any of the universities. I think it tends to fit in for people if they live around the area. But obviously we border Cheshire, Staffordshire, Wolverhampton, Worcestershire, Powys, Herefordshire. So we can take students from a really wide geographical area to come into the trust. So we have a student coordinator who's a podiatrist, and then they arrange the clinics and depending on what that student needs to achieve whilst they're with us, we'll arrange those clinics and get them a timetable together. Give them some information when they join us. So we haven't had any complaints yet, have we? No. So no, it's been
touch wood.
And so it's always an interesting thing having students and seeing what they can tell us. So they'll have different new ways of working, won't they?
I was going to say, because there's always sort of new things that they might be doing at the university clinics, and so it's interesting to see what they're doing there and what we can take from them, and possibly see what we can add to our services as well. So that's true.
New working.
Okay, I'd definitely say if you're looking for a career in podiatry, definitely do a bit of research about what the podiatry itself is about, because if you're going into, for example, you're going to do the course at university and you go and sit down. I remember the first lecture we had, the lecturer was talking about gait and a gait cycle. We all turned around and looked at each other. Gait? What's that? But I mean, that's just the walking cycle. So just how you take a few steps and walk. And so knowing, you don't have to know the course in its entirety, just understanding what's expected, knowing that it's the study of the lower limbs, specialising the foot and the ankle, knowing this about the lower body, and really being able to understand and having the desire to sort of see it through, because initially it started off, I remember when I started, the degree itself started off as sort of doing a whole sort of holistic physiology, anatomy studies, and then within the end of this first year into the second and third year is specialised and focused on the lower limbs of the body, the anatomy, physiology, other conditions, and then things like diabetes, rheumatology, or rheumatoid arthritis and all sorts came into place. So for anyone who wants to seek a career in podiatry, I'd definitely say understand what podiatry is, knowing what it's about, just to make sure that you've given yourself that education before you step into podiatry itself. Because I remember within the 2 years of college, you will have 2 weeks of work experience at least, and in that one of the 2 weeks there, we can offer that experience for them. So at least they get to see what's going on within the clinics, and then it helps them make an informed decision whether that's the right path for them or not. But it gives them the idea of what podiatry really is about.